And well, about the adverse events, we saw a little bit more higher rates and the combination arms. So talk a little bit about these results.
Yes, we followed the patient very hard and very close about this, uh, mainly because of the fractures. So it was something that was trying to look very close. And it was easy. We know that radium 223 is not a hard drug to use. And the majority of the patients could finish the 6 cycles without any adverse events that we thought it was really important. So it was easy, it was feasible. We are a little bit worried about the problems of enzalutamide, but it was in both arms. We didn't think that the radium 223 got harder the treatment for the patients.
Yes, as demonstrated, 1/3 of the patients in both arms had hypertension, which was the most common adverse events. And talking about skeletal events, I think from 2019 on, bone protecting agents became mandatory in the trial because the previous results that we had with some other trials. So could you please talk a little bit about it? Because I think, PEACE3 demonstrated very, very well. It's just not combinations with enzalutamide and radium. It's the combination of ADT, enzalutamide, radium, and bone protecting agents. So we're dealing about 4 drugs. This is the combination.
Yes, I think the bone events, it's the most important thing that we was worried about. And Dr. Sirke was always talking about this since the beginning of the trial. And after the data of ERA 223, it was really a problem because this trial started before the data. So in the beginning of the trial, it was not mandatory, the use of bone agent protectors. And we really saw more fractures. But after the data, it got mandatory. And even before the use of radium-223, the patient should start zoledronic acid or denosumab before, like 1 or 2 months before the radium-223. So I think because of this, we didn't have more problems with like bone fractures, and the patients could follow the treatment with no more events like this.
Great. Thank you very much for being here with us to talk about this practice-changing trial for our patients in first-line mCRPC with no previous use of ARPs. Thank you very much and have a great last days of ESMO.
Thank you so much. I really appreciate the opportunity to talk about PEACE3 and to be here in OncoAlert with all of you. Thank you, Barbara.